Hey y'all, it's me, Cody. This is Cody Knits podcast, episode 9. Thanks for coming by. My name is Cody. If you don't know, if you're new to the podcast, I'm from Atlanta, Georgia. Hey, and yeah, this is episode 9, and this is a podcast all about knitting and crochet and yarn and fun stuff like that. So, for those of you who follow me on Instagram, and I'm on Instagram at nurse underscore Cody, Codi, and then I'm on Ravelry and YouTube as Cody, Codi Knits. And yeah, so if you follow me on Instagram and Facebook and stuff, then you know I inherited a new birdie today. This is Billy Bob. You can see him, he's kind of hiding a little bit. So we had originally gotten Billy Bob. My mom named him, but we originally got him for my niece, and we bought the cage and all that toys, and we got him. Well, my mom got him uh, when he was still a little baby, like just born, and they were hand feeding him and all that stuff. So he's used to being held and that kind of stuff. But my niece has kind of, she's only 7, I think, and she's a little bit too rough with him, and um, and really wasn't interested in taking care of him or anything like that, especially after the first little bit. And then she doesn't understand, like, you can't squeeze him and stuff like that. So he bit her one time a little bit, and she didn't like him after that. But he's really a sweet bird. He is a love bird, and he chirping in my ear is loud. He's really not that noisy of a bird. And some of you asked, like, you had heard some bird noises in some of my earlier podcasts, and those were I had a parakeet originally, and my stepmom just fell in love with it, and she's from the Philippines, and she was saying that she used to have birds over there, and she just kind of missed them. So got her a bird for Mother's Day. Well, I wanted to get the bird at I got the bird at like a I think it was Petco, PetSmart, but I wanted to get the cage at a different um, location, and anyway, it was already kind of late in the evening, so it was going to be closed. So anyway, I bought the bird. And he was beautiful, and I put him in the cage with my bird. Well, they fell in love. um, my bird was a girl and he was a boy, and so it was about a week, before Mother's Day, and then it was like almost another week before I actually got to see her again. Yeah, I'm talking. And so anyway, the birds kind of bonded together, and give, I couldn't separate them. I just couldn't make myself do that. Even though I love my bird, but I can still go see her and stuff, and she enjoys his company. So anyway, I gave them to my stepmom, so I was without birds. And then Billy Bob here needed a new home, and my mom, lovebirds aren't really cheap birds, especially getting them hand fed and stuff like that, so that they're kind of used to being around people and that kind of stuff. He's still kind of getting used to me a little bit, but he's sweet. He's only 5 months old, so yeah. Anyway, so so I inherited Mr. Billy Bob. The only way you can tell if they're boys or girls is really by blood test, and so he could be a she, but I don't know. But my mom has always called him Billy Bob, so that's what I call him. He likes to play with your hair and like he'll peck on the like I haven't shaved in a while and he'll peck on that and your ear and stuff. It's funny. But anyway, we're here to talk about yarn and knitting and crochet. So I got some stuff to show you. I don't know if he's gonna stay here very long, but and this is a very this is gonna be a very uh disorganized probably podcast. I don't have any notes or anything like that, um, and it's not going to be edited. I am, for those of you who don't know, I'm in school. I'm in getting my master's degree to be a family nurse practitioner, and our summer semester is coming to an end. So I had 2 tests today and a project presentation to present. So I'm exhausted because I've been there all day. And then I have clinical all the rest of the week, and then I have finals again. I have finals on Monday, so I have two more big finals. Um, and we had so many issues with our test today. Like we were supposed to have EKG or ECGs. We were supposed to have those in our on our test, and um, the actual we do them online, so the EKG didn't show up, so we couldn't tell her what we were seeing, and then we have to do this capstone project in order to graduate. It's not really like our prospectus piece of it is due kind of like what your plan is, and get them to approve your project and stuff like that. Yeah. It's due by the end of this month. Sorry. It's due by the end of this month. So I had to anyway. So we had a meeting at lunch, and um, so at 9 o'clock I had one test, and that lasted till like 10:15 or 10:20. So at 10:30 we had lecture until 12, and then from 12 to 1 we had our capstone meeting, and they were nice enough to provide us lunch, which consisted of a baked potato. And then at 1 o'clock we had our second test, and then after that test we had presentations. So from 1 we had so basically from like 2:15 until 4:30 we had um, our presentations, and then after that I had to meet with my individual capstone person, teacher. um, it hurts when she does that right in your ear. Yeah, it does. So he's still trying to get used to me, and I'm getting used to him, and that kind of stuff. So I try to. He's been in his cage all day today, and I don't want him to have to stay in the cage. Get. I don't want him to be that. I want him to get used to me, and I know I'm just going all over the place here, but another thing about the birds, someone had mentioned like you have to have two because they're lovebirds, and that's true because they do develop a big bond with one another, and they're cute how they love on each other. But if you want the bird to bond with you and you're willing to spend time with it, then you really need to only get one at a time at least, and like let that one get used to you and that kind of stuff. So if I wasn't gonna have time or wasn't planning on making time to have him, and I didn't want him to, be social and get out and sit on my shoulder and stuff like that, then I would get, I would have to. But so I have to be his friend, and I'm perfectly okay with that, even though he poops all over my shoulder. That's okay. Yeah. Um, Diamond and him, Diamond was a little bit jealous at first, but she's a little more curious as to what is that thing. She's used to the other birds when they were here. So she just kind of sniffs it, but it kind of freaks the bird out because the dogs come in and I still have to watch, But anyway, yarn stuff. So let's start off with finished objects because I have a couple of finished things. And this is one of them. I'm sorry about the lighting, but this is the Perk Me Up cowl that Erin from Give Me Yarn 418 designed, and it's lovely. I love it. It was a good knit. It was easy, but it wasn't boring, and uh, quick. And someone asked me on my when I put a picture of it on Instagram if it would be a beginner's project, and they had mentioned that they had made the handbrake. And I was like, basically, if you can make the handbrake, then you can make this one because it's knitting and purling in the round. So you have to know how to do it in the round. You have to know how to knit, and you have to know how to purl. And all it is just different. Is a different variation in that knitting and purling pattern. And yeah, I really like it. I washed it in some soak wash, and that has a beautiful smell to it. It's not like a strong smell, but it's light, kind of almost rosy kind of scent, and I really like it. But this is going to go to my Aunt Carol because she has a red coat, and I think she'd like to have this with it. Maybe I'll ask her if she wants it. If she doesn't like it or doesn't think she wants it, I made this out of a what was the yarn? It's like a superwash merino XL something. I don't remember, but it's really soft and nice. I don't find it itchy. Oops, sorry, I scared her. I don't find it itchy, but some people might because it is wool. That's really the only knitting project that I have finished. The other, this is crochet. I finished that one. It's a hat. I make hats for my patients to give when their hair falls out. So anytime I have, especially if I have extra, yarn from a project, I will make things out of it. And this is another hat. I just kind of did a little bit of striping kind of thing. And this is the yarn left over from my water sprout shawl that I made. And it's just double. Is it double? Yeah, it's just double crochet. Okay. Um, that's only. I think that's all I have finished. Let me check, double check. Yeah, that's the only thing I have finished. I'll show you my whips now. Works in progress. So I was gifted because I had mentioned in my last podcast that I think I wanted to try to knit real socks. I had knit some like big kind of like slipper kind of socks, and I didn't use sock yarn or anything, but someone gifted me this yarn as well as the pattern, and they know who they are, and I thank you so very much. And but yeah, this is how far I've come. It's a I guess it's a top down. So this is the ribbing, and this is the leg part. Um, and this is a hold on, I'll tell you the yarn. I already forgot. Malabrigo sock, and it's Persia 852 is colorway. And it's really pretty. It's got some greens and blues, darker blues and greens, and I really love it. It's super soft and a lot of fun. And I'm having a really good time knitting these socks. I'm knitting it on double pointed needles, and I started it off on some bamboo ones, and they broke. One of them broke because I was too tight, too rough with it. Ow! Don't bite so hard. Yeah, be gentle. Be gentle. Easy. um, he was biting my shirt, and he actually accidentally got my neck a little bit. Anyway, I am having ladders or like runs, in the, you know, whatever this is called, where you're going from one needle to the next. I think what I was doing was easy. I think what I was doing was easy, easy, easy. I think I was actually trying to, since I was trying not to have the laddering, I think I was, pulling it too tight. Shh, Billy Bob, no, don't. That hurt. Yes, it hurt. I don't know why. I don't have a necklace on or anything. Anyway, that's it. What I got. And let me show you. I only have one other work in progress. Oh no, I have two. This one and one more. Don't be so. Ow. Hold on, let me a second. Come here. Here. Give me your feet. Step up. Step up. Step up. Step up. Step up. Woo. Here. Be right back. Step up. Step up. Step up. Step up. There. See? You know, step up. Look. You know how to step up. I don't know why you're not doing it today. You must be mad at me because I left you. I wasn't home all day. Is that it? Stand up there. Anyway, sorry. As you can see, he can't fly. He has his wings are clipped so he can't fly away. Um, I usually keep my birds' wings clipped. They clipped his a little differently than I clip mine. I usually clip them so they can still fly like vertically. They just can't go horizontally. And whoever trimmed his trimmed them so he can't go anywhere. um, this is in my bag from JC at JC's Sewing Room, and in it is my Messalina by the wonderful Kay Jones. Kay Jones. Um, this is where I was last time I showed you. I put a little marker, and this is how much I've gotten done. I really enjoy knitting this. I have the pattern memorized now, so I don't have to think, I don't know. It's easy. If I can memorize the pattern and it's a 4-row repeat and I can remember, you can too. I'm really having a good time knitting that up. Okay, here's the other thing that I had been working on. And I'm actually really frustrated because I got this pattern, which, you get what you pay for, right? Well, I got this pattern, it's free, offline, called Classic Baby Sweater. And that's exactly what I wanted. I wanted a sweater that's for a baby, and you can knit it kind of. I didn't want it to have buttons like a cardigan. I just wanted a sweater. Um, I've never made a sweater before, but the instructions on this are very confusing. They're not, this isn't a good pattern for people who don't already kind of know what they're doing. Because I really, oh, hold on, here you go. Step up, step up. Good, good. So what I didn't like about it doesn't tell you. I mean, at first I was like, yeah, this is great. You do this little um edging and then and then you just knit and purl stockinette stitch for so long, and then you're supposed to do these decreases, but they're not written out well. It says like, okay, this is supposed to be the back. It says, and I can tell you this because it's free. Pattern. I didn't get it off Ravelry. I just Googled it. Allfreeknitting.com is where it came from. It says on the back, knit 3 rows, and increase 2 stitches evenly across the last row. So you have a total. So I understood that. So I had the right number of stitches. Then it says to work in stocking stitch for till it measures 5.5 inches. Okay, then it says shape raglan. Okay, it says cast off 3 stitches beginning next 2 rows. Then it says next row, right side, knit 1, slip, slip, knit, knit to the last 3, knit 2 together, knit 1. Okay, that makes sense. And then you go to the next one, it says work 3 rows even. Then it says repeat last 4 rows 1 time more. And you're supposed to have 37 stitches at the end of that. And then, anyway, it doesn't flow like I mean, it says, I don't know. It just didn't make any sense to me. So I'm going to have to rip this out because I would be okay with it, except for the fact that in order to make the front, it says do the same thing. And I couldn't reproduce this exactly because it didn't make, I don't know how to explain it. I just know I really don't like that pattern. It doesn't tell me, I mean, I'm not a complete idiot, I kind of know how to read a pattern, but it's not telling me exactly what to do. Starting at the decreases, it's really confusing. And maybe if I knew more about knitting sweaters, it wouldn't be confusing. But I have gotten a couple of goodies that I want to show you. Oh, if anybody knows of a good, easy to knit baby sweater pattern that doesn't have a bunch of buttons and stuff like that, like, let me know. I don't care to buy it or whatnot, but I just can't with this. The sweater looks so cute, but I can't follow the pattern. Oh yeah. Anyway, I got some goodies. So these came in the mail today. This is some yarn I got from Navi Knit. Let me show you the card in case I'm saying the name wrong. And he actually put this picture of this on Instagram, and I was like, ooh, I want that one and that one. So we worked out a deal, and here we got it. The yarn is very soft. It doesn't have in his Instagram. He put what it is called and all that stuff, but it doesn't have a tag, or I didn't see anything that came with it that said, what kind of. I know it's wool. I can tell that it's wolf. Well, because one, he dyed it and whatnot. But I think this is something about holy explicit. This is it's a unicorn or something like that. I think that one was this one, but it could have been something else. And then this one was something about, um, isn't it pretty? Something about stormy skies and or something. Yeah, yeah, stormy skies or something. But anyway, I'm excited to use these. I don't know what I'm gonna do with them, but I try to support people when who dye and sell yarn and stuff like that and make the bags because I know it's rough. Also, this bag here I got, and it's just perfect, like small project size, I think. I got this from Nina at Nina Makes on Etsy, and this is her cute little tag. And she's the knitting expat on here on YouTube. Um, but if she was trying to, come up with bags and stuff that are more, a guy would want to carry around. Um, so I mean, I personally don't really, I'm not really whatever about like gender stereotypes, but at the same time, like I don't want to. I just don't necessarily find, a bunch of flowers and stuff like that. That's just not something that, I would want to use or carry around. It doesn't like appeal to my senses or whatever. This is nice, I think. And she also gave me a stitch mark, just a little sweater. If it'll stop shaking, you know, on the knitting needle. And actually, it just came, with the her little tag, but I put it on the zipper to make it a zipper pull because I thought it was cute, and I wanted it to stay with her bag because, she gave it to me, and you know. Anyway, I definitely, if you haven't seen her podcast, you should definitely go check it out. She does wonderful work. She's so sweet, and she has great project bags like this in her shop, and um, I just excuse me, I just really enjoy watching her podcast and just kind of chilling with her. The other thing that I got, somehow I was able to snag a bag from the Bakery Bears Etsy shop from Kate. I was super excited, and it was the one in July. I think it was, she called it like Christmas in July. It's okay. Yeah, it's okay. Yeah, it's okay. Christmas in July, and it came today as well. Oh, I was so excited. I feel like I got something else though. I guess not. I can't remember. If I did, I'll show it on the next one. But this is the cute bag that it came in. Oops, I just showed you all my address. That's okay. It was mine, not hers. Um, so, and I haven't opened it yet. Well, I took the stuff out, but I didn't go through it yet because it was so cute. So she wrote me this cute little note on here, and she always. This is the second thing that I've gotten from, like, I won one of their prizes, the first giveaway that they did, and I absolutely loved that. Loved it. It was this little notions bag, and it's just really thick, durable stuff. And I keep her little, like, it came with a little card. And then I keep this with the methylene that I'm making, and I've been keeping a track of how many rows it's taken me, um, just because, and then my little thing to do the cable. And anyway, so cute. And that came in such a cute little package. And then this one came in such the cutest little package, very personalized. Even though you're buying something from her, especially or from their shop, their stuff's literally sold out in 2 minutes, literally. And she had a pretty good bit of stuff in there, but like, bam, it was gone. I was like, what? People just love it. So here's what she wrapped it in. It's some tissue paper and it has dachshunds on it. And as you all know, I love my little dachshund because my little diamond is a dachshund. And she included her card. And also, I thought the washi tape that she used is really cute too. It's like a little cat with a little yarn ball in front of it, what it looks like to me. But she told me she included a little extra treat for me. Ooh, yeah, you hear it. I might not be able to hear out of my ear. You keep doing that. Yeah. Did you want to go down? Can you step up? Ooh. See, he's still kind of scared. And I think that's part of my niece kind of did something to it. Because he should be able to. Can you step up? Step up. Oh, you can't do that. There you go. Let him walk around the bed. Sorry for the rustling if you can hear it. I think a lot of times the thing that she would get scared because birds kind of they kind of it's kind of like how little kids, like toddlers, they put stuff in their mouth and that's how they explore their world. Well, the birds do that too, but it also, like, if they're going to pick them up or they're going to go from you know their perch to your finger, they want to make sure that it's stable before they get on it. So oftentimes they use their beak to test it out, and I think sometimes that would freak her out, thinking that he's going to bite her. Anyway. So, there's some lovely tea. Ah, I'm going to have some of this tonight. Even though, it smells good. She says it's tea from Chatsworth, English breakfast blend, which is my favorite blend. I'm excited to try it. I have some work I have to do tonight before I get to go to bed for because tomorrow I start clinical at my OB/GYN clinical. So I'll be working with, you know, mommies and babies, and I gotta just do some prep work for that. Good boy. But this is the bag. I'm sure you're all super. Look, it's kind of like a Christmassy. It's like a cowboy and it's Christmassy. Santa Claus on the horse, and it has the awesome little bakery bear pin. I like that it has the handle. Ah, it smells good. And this has a little snappies. Anyway, lots of room on the inside. Um, I think. And they're all like good and thick and sturdy. They're not, they're not flimsy. Like it sits up. It sits up. So that's always a good thing. And the little snaps are heart. I think it's cute. Well, hello. Anyway, I just love it. And I love my tissue paper, and I wanted to make sure that I didn't, but I've never seen tissue paper like this. So it's definitely going to be kept. Um, let's see. What else? That's all my new stuff, I believe. Oh, I did buy another, uh, what you call 'em? Cable needle. It was like on sale for 49 cents, and I only had the one, and this other one shaped a little differently, and I'll just see if I liked it better. So, I've had a few questions, and I was going to answer them this episode, but I think I'm gonna wait till the next one um, because I'm tired and I still have a lot to do. Um, but one thing I remember off the top of my head was what is, because I've been talking a lot about school, is what's next for me? What is it as far as school? And I will be I graduate in December, and I'm hoping I'll take, so after I graduate, I'll have my master's in Master's of Science in Nursing, and I will have completed all the requirements and stuff needed in order for me to take my board examination. So that's a big test. I believe there's like 140 or 100 something questions um, on it, but in order to take the test, you have to, show proof that you completed certain courses. You have to make a certain grade in order to actually pass the classes. But they do that. You can't make below a 75 test grade average and pass a class. So um, so that's part of the requirements for boards too. And so basically your school sets it up so that you're not even going to be able to try to take boards if you don't make the grade. You'll fail out of the program. And then you have to have so many clinical hours and adult health, pediatrics, and OBGYN. And because I'm doing family nurse practitioner, I have to have some knowledge in caring for, everyone from the kids through adulthood and pregnancy and that kind of stuff. Now, I'm not going to be a midwife. That's another option that you can do. And midwives basically are, deliver babies and stuff. I'm not going to do that, but I could. I'm not really. Well, anyway, that's not what I'm going to do. I'm not really, like, they have another program for midwives, and technically I could work with um, the OB population, but I wouldn't like do their delivery and be solely in charge. Like I probably, if I went and worked in a a clinic, a pregnancy clinic, or whatever they're called. I can't think today. I would have to, I would only be doing like prenatal visits, cares, checking their, bundle height and making sure the baby's growing and stuff like that. I wouldn't deliver. at all. But so I don't really know. I'm going to be, having a family nurse practitioner allows me to, I can prescribe medications, certain medications. Like I can't just write prescriptions for morphine and stuff like that. And I can make diagnoses. So as a nurse, an RN, you can't say that, you can't tell a patient they have hypertension. You can say your blood pressure reading is high, and you need to see, primary care provider for treatment. But as a nurse practitioner, I can say, okay, this, I have the education and the training to say, okay, this meets the criteria for diagnosis of hypertension, high blood pressure, and this is how we're going to treat it. A treatment plan. I can prescribe medications and that kind of stuff. It's similar to a physician, but we're kind of, so physicians are kind of here and we're here. We kind of work with them. A lot of people ask what's the difference in a nurse practitioner and a physician's assistant. We're pretty similar. However, a nurse practitioner, we're independent, meaning that our license are our own license and they're not attached to anyone else's. Like I can practice independently. Um, and now the laws vary by state right now, which is unfortunate. And Georgia happens to be one that needs to, get on the bandwagon a little bit better. Nurse practitioners do a lot of the primary care um, work, and there's kind of a shortage of that in that area. Most medical doctors are going in and specializing in things like cardiology or orthopedics or something because it makes more money. Um, Nurse practitioners, our scope of practice is well within the range of doing primary care. So help, managing the diabetes and hypertension and that kind of stuff. However, once a patient gets to a certain, once they get to kind of like a certain point in their disease process, like say for instance, like, well, if they came in and they have hypertension and we've been managing it and I'm doing all the things that they tell me to do, according to the guidelines and whatnot, and the patient still isn't getting their blood pressure under control, or they come into the office and they have, are having some chest pain and that kind of stuff. I do an EKG, which is something that, a nurse practitioner, we can order that, and we can analyze the EKG to come up with a diagnosis. So if I see on the EKG that the patient is most likely having or had a heart attack, or if they are in a weird arrhythmia or dysrhythmia, like uh, atrial fib or something like that, I would refer that patient to a cardiologist. Does that make sense? So like I'm not treating the more complex disease processes. I'm not qualified to do that unless I work in a cardiac clinic with the doctor. Then I would have more. I'd be doing more of that. So because that's more specialized. But primarily as a primary care, um, we're managing, the kind of the basics. And even for diabetes, we can't, if we're giving them, we started off with one, you know, some pills and that's not working, so we go to the insulin and maybe even added another one, but the patient's blood sugars are still not being controlled well. I would refer them to an endocrinologist to try to, see what else is going on and get their opinion. And really, I I think that it's becoming the medical doctors. I'm hoping some of them are and some of them aren't, are seeing that we can be such a huge value and asset to them because we do the things that they don't necessarily want to do. Um, some of them are afraid that we're taking their patients away, but in reality, um, the research has actually been done and shows that um, we are giving them more patients because we're providing a place where patients, it's affordable for them to come and have checkups and things like that. We're saying, hey, yeah, your blood pressure's a little high. A cardiologist really doesn't have time, nor do they have the I guess they don't really want to see a patient just because their blood pressure is a little bit high and they just need a a pill to take every day and they're fine. They don't want to manage stuff like that. But whenever it gets more complicated and complex, then those are the patients that I'm going to send over to them. If I don't know, if I'm confused, not necessarily confused, but if I'm unsure of the diagnosis and I'm like, it could be this or this, I'm going to send them over there to see and just to, check things out, rule things in, rule things out, have another set of eyes. So we don't take away their patients. We actually refer a lot of patients to them. And we just kind of are the ones like, say a patient has the surgery. A lot of times after their surgery, so if someone hurts their back or something, we're going to send them to, or they're, okay, well, let's use a different example. Say someone has really bad joint pain, and I found out, they have really pretty severe rheumatoid arthritis or osteoarthritis or something like that, okay? They get to a point where that joint is not, it kind of wears out and it's not good anymore and can deteriorate. I'm, I'm going to see that hopefully if they're coming to see me regularly and getting the screenings that I would like for them to do. I'm going to see that they're going to, that their, bone marrow, their bone density is low. They have, their calcium levels are low and that kind of stuff. And I'm going to do things to try to prevent that and prevent further damage. But once that patient says, I can't, I'm having a lot of pain. I can't walk anymore like I could, it's just not bearable anymore. I'm going to refer that patient to an orthopedist and they're going to, do what they need to do. And they'll probably end up getting a hip transplant or replacement is really what they call it, a hip replacement or knee or whatever joint. Then after the surgery, they may have a follow up with them, the person who did the surgery. But a lot of times they say follow up with the primary care provider, and what that means is they're going to come back in a couple of weeks after their surgery, a couple of weeks to a month, and I'm going to look and I'm going to look at their surgical site, see how they're walking, make sure there's no infection, and make sure that they're actually getting up out of bed and walking and using their hip, and they're not having any complications. And I can get them resources like physical therapy and things like that if needed. So that's it should be a partnership. It should be a team. In Georgia, the law is that you have to have a delegating physician or a collaborative physician, MD. So in Georgia, we have to have the doctor does not have to be physically on site, but they have to oversee, double check some charts or whatnot, and and that's not all bad, but it's not all good either. I mean, it's nice. You're going to want somebody you can say, hey, I really don't really know what this is. What do you think? Have that person, especially as a new nurse practitioner, you can go to figure things out, and ask for, like, this is a really weird rash do you think that it, what do you think it is? um, but then at the same time, it also limits the scope of practice that we can do. Like I can't, like we can have our own clinics and stuff, but we have to work in under guidelines and stuff like that. It's a little more complicated than that, but basically, you have to have a delegating physician. Other states, they don't have that because the states see the importance of a nurse practitioner, and especially in really rural areas, they that don't have access to health care, they're getting these nurse practitioners who are willing to go out and live there and provide critical health care to here, critical health care to um, these patient populations who wouldn't get health care otherwise, because um, health care isn't free. And it's expensive, and it costs a lot less to pay a nurse practitioner for things than it does a medical doctor. Not that that's a bad thing. It just MDs go through a lot more training. They have a lot more knowledge in depth than we do, and I see myself. Not everyone agrees with this, especially nurse practitioners. But I see myself kind of as like a mid-level provider. Not necessarily the doctor. And although I do things that are similar to what a doctor does, I'm not a doctor. I'm a nurse practitioner. So anyway, that's what a nurse practitioner is. And I went on that caveat because so many people don't even know what a nurse practitioner is. What am I going to do? I don't know. When I graduate, I know I'm going to take boards as soon as possible. I am open to staying in oncology. I'd want to do outpatient oncology, but I'm also, whatever doors open up, there's lots of opportunities, and so I'm not gonna just, you know, I'm not gonna shut a door to something, an opportunity for no reason. I know you just want to fly. Anyway, so that was a question. Anyway, you guys, let me know. Let me know about the baby sweater. Don't forget to go over, if you have any questions next time. It'll probably be 2 more weeks before I podcast, and I'll have much more time on my hands at that moment because summer semester will be over, and I'll have a couple weeks there. So go to the Codi Knits podcast group on Ravelry, and there's an Ask Codi question section, and you can put any comments you want there. And yeah, I hope you all are doing well. I'm really behind in looking at watching podcasts and stuff like that, but anyway, I don't foresee myself getting much knitting done in the next 2 weeks, unfortunately. But yeah. Anyway, hope you're doing well. Remember, so I keep telling myself too, is do things one stitch at a time, and that's how you get through those tough knitting projects. But it's also a great way to get through our day to day life. Things are hard. We get really busy and overwhelmed, and the best thing you can do is just do it one stitch at a time, one thing at a time, one day at a time. Sometimes even 1 hour at a time, depending on how crazy things are. So anyway, hope you're doing well. Sorry I'm not as edgy and energetic as I normally would be, and thorough. But anyway, hope you're doing well. I will see you guys in a couple of weeks.